All right, it is officially noon, so we'll go ahead and get started. Welcome everyone to the USC Ask an Expert webinar series. This is organized and sponsored by our department here at the Keck School of Medicine in Otolaryngology and Head and Neck Surgery. The goal of this webinar series is to present topics of interest to you regarding the medical issues that we commonly see, diagnose, and treat. This session is not intended to deliver personalized medical attention, but rather to provide education, stimulate discussion, and if you have specific medical needs, we encourage you to make an appointment for medical evaluation. A couple of logistics for anyone who wasn't here at our last talk. There is no audio function enabled, so if you would like to submit a question during this talk, you can do so via the Q&A box at the bottom of your screen throughout the webinar. We will answer your submitted questions at the end of the talk, and we'll answer as many as we're able to get through. Now, I have the distinct privilege of introducing our first speaker today, Dr. Michael Johns. He is a world-renowned laryngologist, a voice specialist with over 200 publications, and he is the director of our USC Voice Center. Thank you, Dr. Johns.
Thank you, Dr. Moyer. It is a pleasure to be here today. And thank you, everyone, for joining in this early afternoon. So today we're going to be talking about vocal health, fact versus fiction. And hopefully you'll have some useful information that comes out of this. We at the USC Voice Center function a little differently because we really function as an interprofessional team. And so I want to introduce our whole team. I'm Michael Johns, and my laryngology practice partner is Dr. Karla Odell. Dr. Odell, you want to turn your video on and wave hi? Soon. Lauren Timmons is our Director of Speech Language Pathology for the USC Voice Center, and she is a singing voice specialist as well. Lauren, say hello.
Hello.
Eugenia Castro is Lauren's practice partner on the speech language pathology side at the USC Voice Center, and she is also a singing voice rehabilitation specialist, and she leads our tech, our acoustics, aerodynamics, computerized assessment of voice. Eugenia, say hello.
Hi, everyone. Thank you. Hi.
Yael Ben-Susan is our laryngology fellow. We have a sought-after training program for specialty care in laryngology. That's voice, swallowing, and airway problems. And she's with us for a year, and she's going to be fielding questions as you type them in. We're going to reserve time at the end. We're going to field all the questions at the end. So we look forward to that, and we thank you, Dr. Ben-Susan, for keeping an eye on the question box. Say hi, Dr. Ben-Susan. And not joining us today on the webinar, but a very important member of our team is Eric Salazar, who is our patient navigator, and he really helps make things happen for our patients to make care seamless with us. So that is our team here at the USC Voice Center. And we're gonna a little bit about voice changes and evaluation of hoarseness in general. It's commonly pretty fragmented. And that's because there's a lot of people who care for the voice, and oftentimes are not in the same place. So when a patient has voice change, they may commonly go see their primary care doctor, see and be evaluated, hopefully get referred to an ENT doctor if there's anything that is concerning. The ENT doc will take a look, make a diagnosis, may say, okay, you need voice rehabilitation, send you to a speech language pathologist at a different time in a different location, often with varying amounts of information being communicated. And so sometimes there's some breakdown in care. Speech language pathologist or ENT doc may say, okay, you're a singer, let's have you be evaluated by a voice coach, an additional person, also with an opportunity for breakdown because of lack of information transfer. And so there can be kind of a round and round cycle. And what we do differently is we bring all the pieces that are important to rehabilitate voice, to diagnose, evaluate voice problems, and improve them as a team. And it's an interprofessional approach, with the patient being the most important individual and their loved ones, of course. The laryngologists, these are ENT doctors like Dr. Odell and myself who specialize in voice, swallow, and airway. Our team of voice specialized speech language pathologists who are also singing voice specialists, we see our patients together in one evaluation to kind of break down that round around. And we bring in our colleagues either in person or virtually in our primary care, GI, pulmonary, and neurology when that's warranted. And through this approach has been shown to lead to better diagnoses, better treatment plans, better adherence to treatment plans, better outcomes, and higher patient satisfaction. So that's just a little overview about who we are. And people who benefit from our care, we take care of voice, swallowing, and airway disorders. Now, today we're focusing on voice-related issues. And so anyone with vocal difficulties warrants evaluation and treatment to improve voice. It's the primary way that we communicate. And we rely so much on our voice, perhaps even more so with the emerging virtual communication that's happening. And people who oftentimes get into vocal trouble are people who use their voice a lot. And so teachers, amateur and professional singers, folks in sales, executives, people who work in call centers, clergy, really anyone. In fact, all of us to a certain extent are professional voice users because basically we get by in life so much based on our voice. So what we're going to talk about today is I'm going to talk briefly about how the voice works and what causes hoarseness or change in voice. Lauren and Eugenia are then going to talk about how to keep your voice healthy with some facts and myths that commonly surround voice. And then Dr. Odell is going to wrap things up with how we treat voice disorders. And we do some really unique things that aren't done in too many places around the world. And then we're going to open things up for Q&A. So talking a little bit about how the voice works, here is a figure of a person highlighting the lungs, and the lungs are our power source. It gives us the air supply, kind of like a bellows picture on the right there. And it creates an air stream from the lungs that goes up to the larynx and vocal cords, which were more commonly called folds. And that creates a sound, kind of like a mouthpiece on an instrument. And the sound is a bit mechanical. If you've ever played a mouthpiece without the horn part on it, you know that well. Same with the larynx. And then everything above the vocal cords, and so that's the throat, the mouth, the nasal cavities, and sinuses, they serve as kind of the horn, the resonator. It shapes the mechanical sound that comes from the vocal cords into the more pleasing sounds that we generate in speaking and singing. So we're going to drill in here a little bit on the vocal cords or vocal folds, and they live right here in the neck, in the larynx. Here we're blowing things up further. There's two. Common myth is that we have one or more than two vocal folds. Nope, we have two vocal folds. And there's this beautiful architecture of the anatomy of the vocal cords, which is really specialized for generating sound. There's a muscle body. There's a ligament that overlies the muscle. And there's this gelatinous layer that's called the lamina propria. This is the mucous membrane layer, which is a specialized mucous membrane layer because it's gotten big and kind of expanded. And that allows this tissue to be very, very soft and vibrate in a regular way to generate sound. And so now we can look at the vocal folds. Now we're looking at the vocal folds from the top. This is the left side of the body and this is the right side of the body. And the vocal folds, they open when we breathe, and here's the windpipe down below, and air goes in. And when we speak, the vocal folds come lightly together, and then as they oppose and air passes between them, they vibrate. So here's a little different depiction, looking at it sideways, and you can see airflow goes up and separates the vocal folds, and then the vocal folds close and it repeats. And this happens really, really fast. The typical man speaks at around 100 hertz. That means 100 times per second the vocal folds are vibrating. Typical woman speaks around 200 hertz, 200 times per second. And as we sing, we can get up into 1,000 times per second of vocal cord vibration. And so over an hour, our vocal folds collectively will have vibrated probably 1,000,000 times. And we change the shape of how our vocal folds meet to generate sounds in different types of ways. And here they are in action using a specialized light called stroboscopy that slows down vocal cord movement so we can see it, because it happens too fast for the eye to see. So here's an example of vocal folds vibrating in this beautiful regular cycle, nice and soft, And we can press them harder together and have a different character of sound, kind of more of a pressed sound. We can speak with the vocal folds a little lighter for kind of a breathy sound. And we can change the shape, the length of the vocal folds to alter pitch. And so here's these vocal folds going from high pitch to low pitch. And they get shorter and shorter, and the pitch goes down. And they get longer and longer, and pitch goes up. And so we make these adjustments without us even thinking about it to change the kind of sounds that we make in a healthy situation. So what happens when the voice changes? What's hoarseness? So it's important to point out that hoarseness is not the same thing as laryngitis. People commonly lose their voice and they say, oh, I've got laryngitis. Not necessarily true. Laryngitis signifies inflammation of the vocal folds, and we'll talk about that a little bit. But hoarseness is any change in vocal quality that occurs from disruption of that regular vocal fold vibration. It's important to not assume that hoarseness is from acid reflux or allergies. These problems commonly don't cause a lot of changes on the vocal folds. And one thing that's important to note is when our voice changes or we become hoarse, it's most commonly painless. You don't have the same kind of feeling in the vocal cords as you do in like a knee. So if you're running and you get a knee injury, you get feedback of pain to say, okay, stop running. With voice change and problems with the vocal cords, you don't get that feedback. And oftentimes people find that if they just push harder, you can get the sound out that you desire, but that's causing more stress on the vocal folds without that feedback, and it can lead to more damage. Basically, if your voice has changed, it means there's something wrong with vocal cord vibration and it needs to be checked out. So I like this. If it doesn't feel bad, there's no immediate consequences, well, what could possibly go wrong? Well, it turns out there's a lot of things that can lead to changes in voice and vocal cord vibration, from infections to what we call phonotrauma, which is injury from voice use. Age-related changes. As our population is getting older and older, we're seeing more vocal atrophy and age-related changes. Autoimmune disorders, inflammatory conditions can present on the vocal folds. Neurologic conditions commonly present with voice change, like vocal cord paralysis or Parkinson's disease or vocal tremor. And I put in red here tumors, because this is something obviously with voice change. Sometimes the only presentation of a tumor in the larynx is voice change. And so I put that in red. I also put in red scarring. And the reason why I put that in red is we don't have great treatment for vocal cord scarring. So maintaining healthy voice and preventing vocal fold scarring is really important. So here's some pictures. The most common infection that is indeed viral laryngitis. This is your typical, I lost my voice with a common cold. The vocal cords, as you can see here, instead of being really white and straight, they get swollen almost like hot dogs, and they stop vibrating. Voice can get deeper because they've got more weight to them. Fungal laryngitis we commonly see, and the most common cause is inhaled steroids. People take inhalers for a lot of different lung conditions, and they deposit on the vocal cords, and that can lead to this whitish growth, and that leads to voice change. Less commonly, bacteria, you can see it's a little more yellow here and kind of crusty, can present in the larynx, and it usually can it can be quite severe, and you can have breathing problems. So infections are common. This series of pictures shows examples of phonotrauma, or injury from voice use. This is a vocal fold hemorrhage. You see how there's blood that has filled one of the vocal cords. A blood vessel got broken basically during vocalization, and then blood leaks out, and that leads to voice change. This is a big vocal cord polyp. It's a hemorrhagic polyp. A blood blister formed from vocal trauma, and then the body kind of fills it in with tissue. This is a vocal cord cyst. It's when some of the lining gets buried below the vocal cords and it forms its own sort of ball of the normal fluid that it would secrete into the surface of the world, but it just stays trapped in there, and it forms a cyst that changes voice. Everyone's heard vocal cord nodules or nodes. Those are kind of like calluses. You see these two little bumps here in the middle part of the vocal cords. That's where the most trauma is with vocal cord vibration. And so over time, just like anywhere else on the body, you can get calluses develop. And these are reversible. Common myth is that when you have vocal nodes, it's all over, voice is never going to come back. False. we have great treatment for vocal fold nodules. And this is an example of vocal fold scarring. And from the normal pictures, you saw how both vocal cords vibrate. Here's an example. You can see one vocal cord is just not vibrating at all. And this is a tough problem to treat, but we've got some emerging treatments for it. Age-related changes are really common. What happens with that is, as we get older, some things get weaker. We lose some muscle mass. Things get dry. Some things get kind of stiff. Some things get kind of saggy. And we see that in the vocal cords too. Here's our thin-appearing vocal cords, and they tend to not meet as well in the middle and not vibrate as well. And we've got strengthening programs and occasionally some procedures that we can do to restore voice that's associated with age changes. A common condition that we see is vocal cord paralysis or weakness. And in this video, you'll see one vocal cord, this one here on the right side of the screen, which is the left side of the body, doesn't move at all. See, the right side moves, but the left side does not. And there's a big gap between them, and people lose their voice down to a whisper. Another condition is called Spasmodic Dysphonia. And the vocal cords are overactive, and the voice gets very strained. And a very tight, strained sounding voice. And this we treat with Botox injections. Tumors can grow. They can be benign. This is papilloma from the human papillomavirus. They've got warty growths on the vocal cords. And this is a vocal cord cancer. This is what we're most concerned about. And this is why we recommend that if you have hoarseness that lasts longer than 2 weeks, see your otolaryngologist, come see us, and we'll get a diagnosis and we'll establish a treatment plan. So hoarseness lasting longer than 2 weeks is not a viral upper respiratory tract infection, the voice loss with the common cold. That it's important to treat with voice rest, at least modified voice rest where you're only using your voice for essential voice needs. Total voice rest is better. Why? Because that tissue is swollen, inflamed, and injured. And if you really push and talk, you can cause vocal cord scarring. So rest your voice if you get a viral illness and have hoarseness. Sometimes there'll be an incident. You'll be using your voice and something suddenly changes. That is important to get evaluated quickly. That can be a sign of a vocal cord hemorrhage or a tear. And so if there's a sudden voice change, absolute voice rest, silence, and then ideally be seen and checked within a week. Hoarseness is pretty common after surgery because in surgery, breathing tubes are often put between the vocal cords to put people to sleep, and they can lead to, so some hoarseness after surgery is normal, but it doesn't resolve in a week. Time to get checked. And how do we evaluate this? We have a detailed assessment process, but at the end of the day, we end up looking at the vocal cords to get those pictures like I showed in the previous examples. And it turns out it's really easy to do. It's not hard. Here's me back when I didn't have gray hair. A rigid scope that goes in the mouth, easy, comfortable. Here's a flexible scope that goes through the nose, and we can get high resolution, high definition pictures of the vocal folds. So that's a little overview about how the voice works and what can go wrong. And I'm going to hand it over to Lauren Timmons and Eugenia Castro.
All right. Thank you, Dr. Johns. So Eugenia and I are going to talk a little bit about vocal myths, fact or fiction, and as we explore some of those, talk about how to keep your voice healthy. So there are a lot of myths out there, I would say. Eugenia and I are both singers, so as speech pathologists and singers, we've especially encountered a lot. And I think that stems from the fact that it's kind of like a little black box in here. We can't see the vocal folds. We don't always know what we're doing with them. As Dr. Johns pointed out, we don't have pain really there. So it's easy for myths to spread. So let's take a look at our first fact or fiction and explore this. Next slide, please. Okay, so fact or fiction, we can directly hydrate, heal, or soothe the vocal folds by drinking water, tea, or honey. Now, this is something that I have heard a lot, especially when I was an undergrad singing a lot. I thought this. I would always put honey in my tea because I thought that I could directly hydrate the vocal folds and put something really soothing on them. So let's see. Kind of popped up already. But this is fiction. And let's talk about why. Next slide, please. We can't directly hydrate the vocal folds with water or tea or honey or any other item, lozenge, throat spray. And the reason is because nothing we eat or drink can touch the vocal folds or resolve hoarseness. When we swallow, now our vocal folds sit in here. When we swallow, food and liquid don't touch the vocal folds because they close and there's a cartilage that flops over the top of them called the epiglottis to actually protect the vocal folds because they are at the top of your trachea or airway. So the only time food or liquid touches our vocal folds is when it goes down the wrong way. And we've all had that experience before where we're drinking water too quickly or you're laughing while you're drinking and you choke on your water. And that is when indeed it has touched the vocal folds. But hit next for me, please. Hydration is important to vocal health, even though water doesn't directly touch the vocal folds. So there's two types of hydration that we think about when we think about the voice. We think about systemic hydration, which that's internal hydration. That's the water that you drink. You're drinking water and you're systemically hydrating yourself. And then we have surface or superficial hydration, which is kind of the moisture on the vocal folds on the surface of them. And that can be affected by things like ambient air. Are you breathing in really dry air or are you in a more humid place? And hydration matters because vocal folds that are dry don't vibrate very well. And when they don't vibrate very well, we have to use more air pressure. Air comes up from the lungs to vibrate the vocal folds and we shape the sound. But when they're dry, they kind of stick together a little bit. I always tell patients it's kind of, I don't know why I think of this, but it's like if you step on gum and you lift your shoe up and it's kind of like that, dry vocal folds stick together a little bit. You need more pressure for them to vibrate. And you're at a little bit of a higher risk for vocal injury or feeling more vocal effort to talk is what studies show us. So let's look at some things that we can do to stay well hydrated. The first is target systemic hydration. So we know that sedentary adults lose about 2 to 3 liters of water per day. So we need to replace that. And that can be replaced with water. It can be replaced. Some of that hydration that we need comes from food, actually, so especially like wet snacks like grapes, but other liquids can be good too. And we don't know the exact amount that a person needs to drink. And that's because everyone's different. It depends on the climate that you live in. Do you live in a really dry climate? It depends on how active you are. Are you exercising a lot? You're going to lose more of your water that way. So it's really dependent on each person. And this may sound strange. Some of you may have heard this before, but we typically tell people pee pale. So if your urine is a pale color, then you're probably, for many people, well hydrated. Other strategies are surface hydration strategies. Sometimes people come in and they tell us, I'm drinking 3 liters of water per day. I feel like I can't drink any more water, and I still feel really dry. And so then we'll talk about some surface strategies, which are doing things like using a humidifier, putting moisture in the ambient air that you're breathing so there's moist air going past your vocal folds when you're breathing. Or actually steaming, breathing in warm steam. You can do that in the shower. The old-fashioned way would be to boil a pot of water and then very carefully breathe in some of the steam off of that. And newer research shows us that actually nebulized saline can work pretty well. And this is not something super fancy. This is using like a little handheld nebulizer and isotonic saline. And new research is coming out saying that that can work as well as steam, if not better than steam, actually. So hydration matters, but it's not touching your vocal folds.
Thank you, Lauren. Let's move on to our next fact or fiction. So we are all increasingly dependent on virtual communications, as we are doing right now. And it seems that this modality will be with us for the long run. So many patients tell us, what's happening? I feel more vocal fatigue. I'm feeling more tired, but I'm doing the same job. It's just that now I do it from home via Zoom or via other platforms. So fact or fiction, talking on the phone, FaceTime, Zoom, or virtual communication for long periods of time can increase the risk of voice problems. Let's see. We can click on the next to see if my animation works. Yes. fact, actually checked. It does happen. Research shows us that we tend to increase vocal loudness while talking on speakerphone and FaceTime or Zoom. And as we already know, extended and persistent use of loud phonation can lead to an increase in vocal load and fatigue, which in turn can trigger voice symptoms. I think we can move to the next slide. But why? Well, there's some altered auditory feedback, the perception of distance, and our natural tendency to just increase loudness when we are in background noise, also known as the Lombard effect. All of these factors play a role, meaning even if you are yourself in a quiet room, your brain might be perceiving that your communication partner is not there with you, and it might very accurately perceive that they are far, far away from you. And they do actually maybe have background noise going on their end of the communication. And your brain is telling your body your communication partner is not hearing you very well. Well, this automatically triggers our natural and unconscious tendency to speak louder. It's not our fault, it just happens. Okay, I think we can move to our next slide. But how to avoid this, right? What can we do about it to make this better? Number one, optimizing your vocal health. And this might mean budgeting your vocal dose differently than you would do during in-person communication interactions. Maybe scheduling your virtual meetings with some time in between each other with enough time to rest. Maybe 10, 15 minutes. 5, it's maybe even okay. And we like to call this vocal naps, or a short time for your vocal folds to rest, short time of meaning of complete silence, right? It's also a good time to stand up and move a little if you work all day in front of your computer. Another good idea would be to warm up your voice a little bit before vocally demanding events or long periods of virtual meetings, right? So a little bit of a humming, some soft glides, a little bit of a lip trill if you are up for the challenge. Soft and easy, right? 3 minutes, 5 minutes. We don't need a lot, but a little bit of moving around and oiling the engine before we commit to the challenge of a long virtual meeting or presentation. Number 2, optimizing our environment. And some of these tips over here might be intuitive and you might already be doing this and be a pro. Some of this might not. So reducing background noise for all participants involved. So you and your communication partner. Making sure your full face is visible. We get communication cues from facial expressions, and we actually, all of us, read lips. Adjusting light, so having a nice light behind your computer facing your face so that you're well illuminated. Adjusting shadows, making sure you have a stable internet connection. And I can just not stress this enough. We are very reliable on Wi-Fi, but Zoom and other platforms that use audio as well as visual live are very bandwidth hungry applications, meaning a faster speed and stability can reduce better experiences with lower latency or delay. And so I can't stress this enough. The old-fashioned Ethernet cable connection directly to your computer, it's the must. Or getting a little adapter if your laptop doesn't have that square hole to plug in your Ethernet, getting an adapter for your computer. So we know that actually in lag and latency, it's very annoying in virtual communication, and it triggers a lot of, can you hear me well? So yelling that we want to avoid. Okay, another thing that can help us, using technology in our favor. And as I like to put it, Your experience with virtual communication will be only as good as the technology you're using to support it. So if you have the chance, using technology that offers live monitoring of your own voice is very important because it reduces the cell yell effect. What does this mean? It means that you should be hearing your own voice, yourself, as loud and clear as your communication partner's voice through your headphones. And there are certain equipment and headsets that offer this and others that don't. So be aware, buyer beware. So also thinking about the investment, right? Well, if virtual communications are part of your work setting right now, you might need to make the changes and adjustments to maintain a healthy work environment for you and your voice. Your prior office might have included or required, a quiet room, a desk, comfortable table, chairs to sit in, and for your meeting partners. But now your new virtual office also needs and maybe includes and requires appropriate technology and devices to help you in order to reduce the risk of having voice problems. In my next slide, I have some examples using a headset altogether, like my colleague Lauren Timmons was demonstrating, that has a microphone included with the headset on top that says something like offering live microphone monitoring capabilities or zero latency voice feedback. Those are key terminology to look for. Another option, using a USB microphone or an audio interface with a microphone and connecting your normal headphones that you probably already have some with a cable directly to that microphone to obtain that live monitoring feedback functionality. Okay, I'm going to pass it on to our next fact or fiction.
Okay, thank you, Eugenia. So our next fact or fiction: most voice problems can be fixed with voice rest. Let's see what we said. Fiction. So let's talk about why, because you heard Dr. Johns talk about voice rest, and voice rest is sometimes indicated. So there are a few things, well, there are a lot of things that can go wrong with the voice, and only some of those are appropriately treated with voice rest. Let's go to the next slide. So some problems with the voice are caused by too much or too intense voice use. And Dr. Johns showed you some pictures of the vocal fold hemorrhage or nodules or polyps. And those are caused by the vocal folds hitting very many times and hard. So that would be loud voice use or a lot of singing. And in those cases, sometimes we need voice rest, but sometimes we only need small doses, and it's hard to know what you need. So it's important in those situations to have guidance from your physician. Some voice problems are related to illness, like Dr. Johns mentioned, like viral laryngitis. In that case, if you're sick and you've lost your voice because you're sick, we don't have to know exactly what your vocal folds look like, but and we know that your vocal folds are inflamed. And so that is a good time to rest your voice. But other voice problems can happen too. There are some voice problems that can be related to not enough voice use or deconditioning. And we see this sometimes when people who maybe used to be vocal athletes, they were singers or actors and they were singing all the time. And then over time, with aging and not singing as much, they actually lose some of their vocal endurance. Well, that person's not going to benefit from voice rest very much. That's going to actually probably hurt them further. So they would want to see a voice specialist, a laryngologist, and a voice specialized speech pathologist for guidance on what to do about that. And then many voice problems are not caused by the amount of voice use at all. They're not related to too much voice use or too little voice use. And in these situations, we definitely want to make sure that we're treating correctly. So you don't want to do a lot of voice rest if you have one of those voice problems that's not actually even related to amount of voice use. So the moral of the story is not all voice problems can be fixed with voice rest. Some can be helped by voice rest, but it's important to do the right amount and at the right time. So if you lose your voice after a lot of talking or shouting, or you lose your voice because you're sick, it's a good idea to rest it the next day or maybe a couple days, because you know that you used your voice too much or you're sick, but your voice should recover within a few days. If your voice does not recover, or you had one of those sudden moments of voice loss like Dr. Johns recommended, in that situation, or in the situation of your hoarseness lasts longer than 2 weeks, it's time to see your ear, nose, and throat doctor or laryngologist, who's the voice specialized ENT, to make sure that you're doing the right thing for your voice problem. All right, and we'll pass it to Dr. O'Dell.
Hello, everyone. Good afternoon. I'm Dr. Karla O'Dell. Nice to meet you all. And what I'm going to finish off with in the last 20 minutes, 10, 15 minutes or so of this talk prior to us getting your question is what we can do when something does go wrong with our voice. So I'm going to talk a little bit about technology and advances in voice care. So the first thing that we need to do when you have a problem with your voice is do a comprehensive analysis of the voice and an examination of our vocal folds. We have amazing technology nowadays that allows us to look very detailed at the vocal folds. All of the pictures that Dr. John showed you in his talk were all taken from our office. And this is a picture of me taking a look at the vocal folds. It's a very painless procedure. And vocal folds in real life are only about 1 centimeter in size, but we're able to visualize them up on a big screen. And that allows us to make a very accurate diagnosis of what's going on. We also do a comprehensive analysis of the voice with both a laryngologist like myself or Dr. Johns, or one of our voice specialist speech language pathologists like Timmons or Eugenia Castro. And they amazingly, listening to your voice, actually the quality of your voice can give us a lot of clues as to what's going on in the vocal folds. So once we've identified what the problem is, what are some of the options? What are our advances in treatments that we have? Well, one is actually voice therapy. And it's amazing how much of how you use your voice can really impact how the voice sounds. And voice therapy is similar to physical therapy for the vocal folds. It's a series of exercises and treatments that are specialized to your voice problem that can really make a big difference in voice quality. And this is a photo here of Lauren taking acoustics and aerodynamic measurements of a patient. So we're able to use computer programming to actually get an analysis of the voice and also analysis of the airflow, which helps us accurately diagnose what may be going on with the vocal folds and be able to monitor treatment moving forward. I think the most important advances in the field of laryngology is really moving out of the operating room and really moving into the office. With technology advances in imaging, we've been able to take conditions that previously required having to have general anesthesia, go to sleep, take a whole day off work. All of this recovery that were previously done in the operating room now can be done in the office. That doesn't require general anesthesia, doesn't require any sedation, allows you to get back to the rest of your day immediately following that. An example of this is one of the conditions we talked about today is vocal fold paralysis. This is when one vocal fold doesn't move. When one vocal fold doesn't move, as Dr. John showed in the picture, the vocal folds are unable to touch completely. The voice sounds whispery, it's hard to get loud, you run out of air. There's difficulty with swallowing, especially with liquids. As Lauren mentioned, the vocal folds close to protect our airway when we swallow. This video, I know people are having a hard time with the audio. This is a very quiet sound, but you can hear how whispery this voice sounds.
There is a live any beautifulers.
You can see the voice is quite quiet. So what do we do for a vocal fold that doesn't move? Well, when one side doesn't move, the vocal cords can't touch each other. And when they can't touch each other, you can't make sound, and that's why the voice sounds so quiet. And one of the things we do is it's called an in-office vocal fold injection. What this does is it actually plumps up that vocal cord that doesn't move. We can't make it move again, just like if somebody has a spinal cord injury and they're in a wheelchair, they're not able to walk again. We can't necessarily make the vocal folds move again, but we can make the voice better, and we can make swallowing better. And we do that by injecting a filler in the vocal cord in order to plump it up so that it can touch the other side. And this is a photo of how this procedure is done. It's done in the office. It's awake. There's no sedation. There's a little camera that goes in through the nose, just like how we normally visualize the vocal cords. And then you get some local anesthetic, and the needle comes in through the front of the neck, and that's how we access the voice box of the larynx in order to inject the vocal folds. And you can see, you know, I'm wearing high heels, and my patients in their regular clothes as well. And this is what this looks like when we do it. You can see that needle that I was showing in the front of the neck actually comes right through into the vocal cords, and we're able to plump up the vocal cord.
And can you come and look a little bit to the side?
So that's the needle going in, and then what you'll see in a minute is that the filler that we inject, in this case, we're injecting some collagen, actually fills up that vocal fold, and you can see now that that vocal fold is able to touch there. And somebody in the chat earlier, one of the participants had said that they do have vocal fold paralysis, and they've been doing voice therapy, and it hasn't been helping. And in some cases, if the vocal cords can't make contact, they really need some more bulk to make contact. Otherwise, you're going to struggle, because when the vocal cords can't touch, the voice is always going to be breathy. So while voice therapy can be helpful, in some patients, they really need this augmentation. And again, you can see it's very painless and takes just a moment or two. Us at USC, oh, this is an example of how the voice sounds before. And then this is what it sounds like after. You can see it's much louder. And us at the USC Voice Center are actually involved in a lot of new clinical trials, because we're testing new injectables to try to find the optimal material to inject in the vocal cord, something that lasts the longest as possible. We are testing a material called Silk Voice, which is actually made from silk fibers that can be injected into the larynx, or synthetic fat. And these are things that we're actively testing and researching here to try to optimize treatment. The other advances we really that have really revolutionized our field is using laser technology. So as you saw, there's conditions that Dr. John showed you guys, polyps on the vocal folds, which are little blood blisters that are there, papilloma, changes related to smoking that we call polypoid carditis, or leukoplakia, which are like white plaques on the vocal folds. All of these things can impact how the voice sounds. And we have a special laser that's able to specifically target those tissues that are abnormal while not damaging the underlying vocal fold. Similar to the vocal fold injection, this is an example of a polyp on the vocal cord. So similar to the vocal fold injection, we are able to do this within the office. So this is done under local anesthetic. It's done with the patient awake. It takes about 15 to 20 minutes. The vocal folds are numbed with some topical numbing medication, and then the laser fiber actually goes through our scope, the same one that we use to evaluate you in the office. And this is what this looks like in the office. And so what you'll start to see is that this polyp on the vocal cord that you can see kind of in the middle there, it's starting to blanch and turn white because the laser is specifically targeting that polyp. And so you can see that there's somebody that looks like this. This is before the laser. You can see this kind of almost like a little snowman, two-headed blister there that we would call hemorrhagic polyp. And then you can see this is less than 3 weeks after that in-office procedure.
Good breath.
And it looks pretty normal, like it was never there before. Another area that has been something that we've been doing a lot of work in that previously was challenging to treat is related to vocal fold scar. So as Dr. John pointed out, there are many layers to our vocal fold. There's the muscle layer, and then there's this special sort of light purple layer, this lavender layer that you see here in the schematic, which is our lamina propria. This is the layer that gives the vocal folds their ability to vibrate. Many of you maybe have heard about Julie Andrews. People often ask us about that, what happened to Julie Andrews? Well, she had a surgical procedure that resulted in some loss of this lamina propria, which caused scarring on the vocal folds. This is a material that we can't replace. And this is sort of a video of what a deep scar looks like here. You can see there's kind of like this whitish divot that's there on the vocal fold. Where that portion on the vocal folds on this patient's right vocal cord, the left side of the screen, but the patient's right, is kind of stuck down. And this is a difficult problem to treat, and we haven't found the solution for it. But one of the things that we're really excited about right now is the use of a material called PRP. So PRP is what is called platelet-rich plasma. And basically, you may have heard about this in facial plastics and hair transplant or in orthopedics because they're using this material in these areas. And essentially, it's your own blood that's taken and it's spun down in a centrifuge to separate out the blood. And the very top part of the blood has this very rich plasma that's very rich in growth factors and has been shown to rejuvenate tissue in other parts of the body. And so we at the USC Voice Center are the first clinical trial that's being done injecting into the vocal folds. And we're very hopeful that this may be a cure or a treatment, at least something to make it better in patients who have scar or who have lost some of that nice vibrating lamina propria because of surgery or other injuries to the vocal folds. So one thing to keep in mind, there are many treatments available for voice problems. Some of them are behavioral, meaning voice therapy, which doesn't require a procedure, doesn't require medication, doesn't require surgery, but really can change how you use your voice, and it can be very amazing. Voice therapy is often paired with many of the treatments that I showed you, and we really work in tandem together. So we don't just inject filler in the vocal cords, we don't just treat with a laser, but we also incorporate voice therapy to ensure that you have the best recovery from those procedures and that you don't have injuries or problems in the future. There are many things that can be done that are minimally invasive. The evaluation can be something that's very minimally invasive and can provide us all of the information that we need. We're lucky. Doctors that work on the stomach can't look inside and see your stomach when they see you in the office, but we can see the problem right away when we evaluate you in the office. We have many in-office procedures, which have replaced many of the reasons to have to go to the operating room. Our field is very much interested in utilizing new technology, lasers, fiber optic scopes, and new technology like PRP. And then as my colleagues have mentioned, it's always important to speak to your doctor if you're experiencing problems with the voice. Don't assume that it's reflux or allergies, and don't assume that it's going to go away. And also don't assume that it's cancer and get afraid, because it likely isn't, and there are many things that we can do to help you. And I think now we can probably take some questions.
All right. Thank you, Dr. Odell. And thanks really from all of us for tuning in. We're going to talk about some questions now. Eric Salazar is on the call, and here is his email. He's our patient navigator, our easy scheduling number, and here's our link to our website. Dr. Ben-Susan, guide us through the questions.
Yes. Hi, everyone. So I'm going to try to go in order and to regroup the ones that have similar subjects. So I think the first question was from somebody who has paralysis and was asking what were the possible treatment other than voice therapy. I think we enter a lot of that with Dr. Odell's presentation, but maybe one of you can just reiterate the treatments we offer for vocal fold paralysis.
Yeah, so sometimes we'll use voice therapy in vocal fold paralysis if the vocal folds are meeting pretty close and we think that just a little strengthening boost is what's required. But at the end of the day, like Dr. Odell said, if the vocal cords just can't meet physically, you can work as much as you want, you're not going to make progress. And so occasionally for vocal fold paralysis, we use voice therapy sometimes, but if we're not making progress, we quickly move to other modalities.
Perfect.
There was a follow-up question about the PRP trial for vocal fold paralysis. Vocal fold paralysis really requires repositioning of the vocal cord itself. And so we're using PRP to restore the delicate surface layer of the vocal folds. But so far, we have not extended that to vocal fold paralysis because it needs more filler.
Thank you, Dr. Johns. There was a few questions on the actual things we use when we do a scope. So in terms of gloves, in terms of the numbing we used. So maybe one of you could just go through the process we do for just our regular endoscopic examination for laryngoscopy.
Yeah, so first and foremost, it's really important to convey to everyone that we have high level cleanliness, sterilization processes, and a practice environment to do all this safely. This has become particularly important with the COVID pandemic, and so we have enhanced precautions related to that. So we wear gloves, we now wear gowns and full PPE and eye protection while we're doing these procedures. Our scopes are high level sterilized in a central processing area that's where the OR equipment's sterilized. And so we have clean scopes. We typically use some numbing medication when we pass a scope through the nose, and it's a combination of topical lidocaine and Afrin. Nasal spray. Afrin's a nasal decongestant to make it a little bit more comfortable. When we use the telescope that goes through the mouth, we typically don't have to use any anesthesia. But relatively painless and very safe and easily done in the OR. I mean, I scope myself.
Perfect. Thank you so much, Dr. Johns. There was another question, an interesting question on singers and how to prevent problems with voices in singers once with age. So are there any specific problems which arise with age and how to prevent them?
I can pop in on this. So Dr. Johns mentioned in the beginning that there are age-related to the changes to the vocal folds, just like there are age-related changes throughout the body. So we do see and expect changes over time to the singing voice. I would say a lot of the time, and Eugenia, you can pop in too, and either see if you see this too, or if you see other things. I often will see people who have issues with the singing voice due to a combination of age-related changes, but also a significant reduction in the amount of voice use. So if you've taken time off from singing or have not kept up, I see deconditioning. So we recommend that people keep up their craft. And especially during the pandemic, it's been hard because performances have been reduced. So I've been encouraging to everyone, keep up your routine to stay in shape. You are a vocal athlete. And so staying in shape keeps your voice flexible and strong.
Thank you so much, Lauren, for your answer. Another subject here about more of problems when we drink water. So some people on the chat talked about water going the wrong way or having laryngeal spasm in your voice box when you're drinking or when you're eating and feeling that food goes the wrong way. What is actually happening and what can we do to help?
I can take that one. So when you drink water or liquids, the vocal folds have lots of cough receptors and protective receptors because they are the doorway that protects your airway. And so it's almost like a Venus flytrap. When something starts to go in the wrong direction, the vocal cord slams shut. Normally, water or liquid should not be going even close to that direction to cause that spasm. So if you are having symptoms of that, you should see your physician to be evaluated to see if maybe your swallowing is weak, if the muscles above the vocal folds are not doing what they're supposed to do and not pushing the food in the right direction. But it is a natural reaction to start to cough when stuff goes in the wrong direction. It just shouldn't happen very often.
Thank you so much, Dr. Odell. I'm trying to get through as many as we can to answer. So I'm going to try to go through another theme here, which is what are irritants to the voice box or to the larynx? There was one question specifically about hormonal changes with menopause, another one with reflux. So I think the question is, what can irritate our voice box and can we have scarring or permanent damage from those things?
Okay, yeah. So a lot of things can, from the environment, from the outside, or from our environment inside, can cause irritation in the throat. So things just like with the fires, just the dirty, smoky, smoggy air, allergies, your body's allergic response to things that we breathe in or occasionally when we eat. Acid reflux can cause irritation in the throat. Now, these things typically, because the larynx is so protected, cause more throaty type symptoms: throat clearing, excessive mucus and phlegm, kind of irritation and discomfort. And so they seldomly lead to permanent changes to the vocal cords themselves. Hormones. So menopause is big hormonal changes that happen, and the effects on voice are variable, and they're not really well understood. This is an area that's really primed for increased understanding. But there are changes that happen in not only the mucous membrane thickness, the hydration of the mucous membrane, and maybe some of the bulk of the muscles, but we don't understand them particularly well. Some people report changes with voice changes with menopause get better with hormone replacement. Some people don't. So it's very individual, and there's a lot more to be learned.
Thank you so much, Dr. Johns. I think we have time probably for one more question that's really important about COVID safety precautions that we take at USC. And a few people are asking, first of all, do we need to get tested for COVID to come see one of you? And specifically, is our care going to be delayed because of the COVID pandemic?
So I'll take this since I'm rolling. Number one, our environment is really incredibly safe, from the screening at the door to social distancing to reducing the total number of patients that are in the clinic at any given time. We've modified our exam rooms to have increased filtration level. There's complete surface wiping between all of our patients. Now, we wear appropriate PPE. When we do a scope, it's considered a possible aerosol generating procedure. Everyone's hearing about aerosols with COVID. They're possibly aerosol generating because most of the time they're not, to be honest. But if someone has a big sneeze or a cough, it can be possibly aerosol generating. So we have a safe environment for that if that were to occur. And then we basically do a high level turnover of the room with what we call a terminal clean. So we're seeing patients in clinic. We're also seeing patients on telemedicine. And we found a lot of value with our telemedicine appointments because oftentimes we can figure out a lot of what's going on, try some things empirically, and can prepare for a really meaningful in-person evaluation. If there's a swallowing problem, maybe we need a swallowing study before. And so we have all the information for an in-person video, just as an example.
Perfect. Thank you so much, Dr. Johns. We have 2 minutes left, so maybe I will let you give the final word and thank you to everyone.
Yeah, there was a question about vocal fold polyps and nodules and these phonotraumatic lesions, and when do we do surgery and when do we not do surgery? So basically, we want to, with phonotrauma, we want to maximize non-surgical treatment prior to considering surgery. So that's any strategy that we can do that doesn't involve surgery, we want to apply vigilantly first. And the reason is number one, it's benign disease, although it can be very impairing. But there's some risks associated with surgery, and the risk is vocal fold scarring. And so we want to be very judicious in that regard. So I did want to cover that question. There was some questions about this. Is this recording going to be available? Yes, it's recorded, and so this will be available. And we are more than happy to see anyone in our interprofessional clinics at the USC Voice Center to get you back on track with any voice, swallowing, or airway condition that you may have. Dr. Dell, will you show the next slide? And this is our wrap about our webinar series, and the next one is going to be coming up in about a month, and we hope that you've enjoyed this. And if you've got questions that you want to ask, we will try to attend to them. You'll see the email there below. Thanks so much for your time today.